Hello, I'm Shelby. I'll be your student nurse today. I'm going to do some hand hygiene and provide you some privacy. Could you tell me your name and date of birth?
Lisa Harvard, 5/26/1963.
All right, can I look at your armband? Okay, I've got doctor's orders to do a head-to-toe assessment on you. Do you have any questions? Okay, so first, could you tell me who the president is?
Joe Biden.
Okay, could you tell me the month?
October.
Okay, could you tell me where you are?
Your bedroom.
Okay, perfect. I'm going to begin with your skin. So I'm going to check the temperature. You're warm. I'm going to check the turgor or elasticity of your skin, and your recoil was very fast, so I'd say that you're hydrated. I'm not noticing any lesions or boils, and the color is appropriate. I'm going to check your scalp. It doesn't look like you are having any dandruff or bugs, lice, any missing patches of hair. I am going to start really with the head to toe now. Okay, so I'm looking at your face shape and everything looks symmetrical. Have you experienced any headaches? No. Also, have you experienced any dryness of the skin?
Just during the winter time.
Okay. Could I have you look at my pen light? I'm going to assess your eyes. So I'm going to put my hand right here and I'm going to do my direct and consensual pupillary eye test. Okay. And then could you follow my light here? Okay. So your pupils are equally round and reactive to light and accommodation. Okay. And then I'm going to have you, let's see, do you wear contacts? No. Okay. I'm going to start with your nose. I'm going to have you cover one nostril and breathe in and out, and then do the same thing with the other side to check your patency. Okay. Yeah. Almost equally patent. Have you been experiencing any sneezing, runny nose? Okay. I'm gonna look in your ears. I'm gonna look for some drainage. Look on this side over here. No drainage. Do you experience any ringing in your ears? Okay. Because you have tinnitus? Yes. Okay. I'm going to assess your dentition and your oral mucosa. So could I have you open your mouth? Okay, I'm seeing some caps, but no missing teeth, and some fillers. But your oral mucosa was pink. Have you had any trouble swallowing? No. Can I see you swallow? Okay. And your trachea is midline. Perfect. Okay. So now I'm going to go ahead and move on to listening to your heart sounds. I'm going to start up here on your aortic. Your pulmonic. Your Erb's point. Your tricuspid. Could you lift your breast for me? And your mitral. Have you been experiencing any heart palpitations? No. Okay. And I'm also going to assess for some jugular vein distension, so if you will look that way for me. Okay, no jugular vein distension here, and do the same, look that way. No jugular vein distension here. Okay, and I am going to check you for edema in all of your extremities and your capillary refill is less than 2 seconds. I'm going to assess the grade of your pulses here. So this will be your radial pulses. Okay, 2+. I'm going to check your posterior tibial. 2+, and your dorsalis pedis 2+ as well, and check you for edema here. You have little bit of hitting edema. And I am going to listen to your lungs now. Starting with your right upper lobe. So take a big inhale in and out. Would you lift your breasts for me? Both of them. Okay, and then take this arm, place this hand on your left shoulder, in and out. I'm going to turn over here and do this side. Okay, and lean forward. Your lung sounds are normal. Have you been having trouble breathing recently? No. Okay. How about a cough or any mucus production? Okay. Well, if you were, I would have to give you incentive spirometer that I need to educate you on. Here's your incentive spirometer. So what you would do is you would take a big deep breath in and hold your breath for 2 to 5 seconds. And you would do that 10 times an hour. So could you repeat that back to me and make sure you use this now.
Okay, I'll make that. Put this on my finger. And I would take a deep breath in.
No, you put this over here.
I'm sorry. I get it back. Okay. Alright. Take a deep breath in.
Mm-hmm.
Wait for 10 seconds.
2 to 5.
2 to 5.
And out.
Blow it out and do that 10 times an hour.
Yes. Okay. And then another thing that we could do to move that mucus and get it out of your lungs is a turn, cough, and deep breathe. So you would turn, big inhale, and you would cough, and that helps loosen up any mucus in your lungs.
Deep breath.
Big deep breath. And out. Yes. Okay. And so I'm going to now listen to your gastrointestinal, but the first thing I need to do, if you would raise your shirt.
Oh my goodness.
So I'm not seeing any lesions or distensions or any abnormalities there. Oh no, you gotta leave it up. Start with the right lower quadrant and then move clockwise. And then I'm gonna palpate and then we'll be done. Okay. You have normal active gut sounds, and now I just need to palpate, starting with the right lower quadrant. And I don't feel anything hard in there or anything like that. So, when was your last bowel movement?
This morning.
Okay. Are you experiencing any flatulence throughout the day?
No.
Okay. When was the last time you urinated?
About 20 minutes ago.
Okay. Are you having trouble doing either one of those things? No. Okay. Next thing I need to do is do your range of motion. So I'm going to check your elbow here. So palm up. Okay. And I'm going to have you bend it towards you and extend it. So flex and extend, but while pushing on my hand. Okay. So go ahead and go up. Okay, and go back down. Back. Alright, go right down. Okay, and then now I'm going to do your wrist. So palm open and push up. Okay, use the back of your hand, push down. Okay. Do the same thing over here. Okay, so Push up. Push down. Push down. Push up. Okay. And I'm gonna go down here. I'm gonna do the same thing with your knees. So push up. Okay. Push down. Okay. And then now I'm gonna have you do it with your ankle, top of your toes. So push up. Push down. Go down here. Push up. Come on, muscles. Push down. Alright, push down. Push up. Okay, so now I'm going to check your gait and your balance. So if you'll stand up. And then I want you to take about 6 steps away from me, heel to toe. Kick, ball, change, turn. Okay, now you can turn around. Okay, perfect. Very perfect. Okay, and now I'm going to have you face away from me, and we're going to do the Romberg test. So if you would, take your arms up to the side. And I'm going to stand here behind you in case you fall, but close your eyes for 5 seconds so I can check your balance. Alright, now you can have a seat. You didn't fall, so that's a negative for the Romberg test. Have you been experiencing any tingling in any of your extremities?
No.
No. Okay. Good. How about any uneasiness when you're walking, like you feel like you're uncoordinated or unbalanced or anything like that? Okay.
How about GSC?
And I need to tell you about the Glasgow-Coma scale. So you would have scored very high on that due to your ocular response. You've been following me around with your eyes, and you did well with the direct and consensual eye test. Your verbal responses, you've been able to speak to me this whole time, and motor responses, you've been able to do everything I've asked you to do today. As well as another thing I need to mention is some risk factors for skin breakdown, which would be your mobility. But it seems like you were able to mobilize on your own with no assistance needed. Your activity, are you up a lot during the day? Okay, well good. Well, I don't think you're gonna have any problem with that. And moisture, you don't experience any incontinence. Are you sure?
I'm sure.
All right. Thank you.